Thrombotic thrombocytopenic purpura, or TTP for short, is a platelet disorder that causes platelet deficiency in the blood, as well as a wide range of other symptoms. In this mnemonic video, we'll cover everything you need to know about TTP so that you'll be ready on test day. We're backstage at a show where a really famous musician is getting ready to perform. In a rush to get into the concert, a huge car crash happened outside, so our musician is quickly throwing on a tank top so that he can rush out and help. By the way, this tank top is our symbol for TTP, since TTP stands for tank top, right? TTP actually stands for Thrombotic Thrombocytopenic Purpura, a disorder of platelets in the blood that causes bleeding. Let's move on to discuss what causes TTP. The celebrity we're following today is none other than the world-renowned artist Adam Levine. Yup, it's the leading star of the famous rock band Crimson 5. Adam also happens to be our symbol for Adam TS13. Get it? Adam for Adam TS13. Adam TS13 is an enzyme that normally works to break down a blood protein called von Willebrand factor, or VWF for short. VWF stimulates platelets to clump together and form platelet plugs to stop bleeding. However, in TTP, the Adam TS13 enzyme is inhibited by autoantibodies. This means that VWF cannot be broken down, so VWF accumulates in the blood to extremely high levels. On this note, let's move on to the car accident outside. The fans were driving by to find parking for the show when they caught a glimpse of Adam Levine through the backstage window. Distracted by the sight of their idol, they all crashed their cars and created a huge pileup. If you look closely, you'll see that the cars were all VW cars. Since VW cars are our recurring symbol for VWF, this VW pileup is our symbol for a buildup of VWF. As we just discussed, a decrease in Adam TS13 prevents the normal breakdown of VWF. As a result, we see a buildup and increase in VWF levels in the blood. In moderate amounts, VWF helps platelets aggregate and clump together to stop bleeding. If there is too much VWF, however, platelets will clump even in the absence of bleeding. This leads to some downstream problems that we will cover next. Before the big crash happened, Adam was finishing up his pre-show meal. In his hurry to help out with the accident outside, he tried to quickly slurp up the rest of his drink. However, he slurped so quickly that his thin straw couldn't take it and became clogged. This clogged, thin red straw is our symbol for microthrombi. Get it? Thrombi is the fancy term for a clot in a blood vessel, and the thinness of this red straw should remind you that we are talking about tiny clots in tiny vessels, or microthrombi. When platelets begin clumping excessively because of an accumulation of VWF, this eventually leads to the formation of microthrombi. This is problematic because as red blood cells try to force their way through the obstructions created by these microthrombi, they can become sheared and broken up by mechanical stress. Now that we've covered the pathogenesis of the disease, let's move on to its clinical presentation in patients. If you look out the window, you'll see the fans who are so enamored with Adam that they've abandoned their total cars to run over. As you might expect, most of Adam's fans are young women. These young women should help you remember that TTP primarily affects young women. If you recall that most autoimmune diseases primarily affect young women, this demographic predisposition should make sense. As Adam got up out of his seat to help, he accidentally knocked over his plate of food. This falling plate is our symbol for a decreased platelet count. You know, a falling plate for falling platelets. The first of 5 important signs to remember about TTP is a decreased functional platelet count, which is formally known as thrombocytopenia. This fall in circulating platelets occurs because a huge number of platelets are used up to form the microthrombi we just talked about. In other words, TTP is a consumptive platelet disorder in which excessive platelet clumping all over the body consumes free platelets and lowers the functional count. On the plate was a bunch of red tomatoes that he was snacking on. Unfortunately, they're now splattered all over the floor. These crushed broken tomatoes are our symbol for broken red blood cells. Get it? Because tomatoes are red and round, kind of like red blood cells, and both are being broken down or lysed. As we mentioned earlier, red blood cells that try to squeeze past the microthrombi in blood vessels become sheared by mechanical stress. The hemolysis of red blood cells causes anemia. The pattern of small platelet plugs in blood vessels destroying blood cells is formally known as microangiopathic hemolytic anemia, or MAHA for short. Along with the tomatoes, Adam was also munching on some kidney beans. They suffered a similar fate of being spilled on the floor. These fallen kidney beans are our symbol for fallen kidney function. The The third symptom that commonly presents in TTP patients is acute kidney injury. This occurs because the microthrombi can block the small vessels of the kidneys, leading to microinfarcts and kidney damage. This is why elevated BUN and creatinine levels are often seen in TTP patients. Can you smell that burning in the air? Oh no, it looks like some of the Volkswagens in the pileup caught on fire. These burning flames here are our symbol for fever and inflammation, since flames remind me of inflammation, and fever is often a symptom of systemic inflammation. Patients with TTP can also present with high fevers. This is actually an important symptom that can help distinguish TTP from other platelet disorders like HUS. In the wreckage, you can also see some stray sparking wires. Be careful not to shock yourself on one of those. These sparking wires are our recurring symbol for neurological damage, since our nerves carry electrical signals, kinda like these wires. So damaged wires should remind you of damaged nerves. Neurological symptoms are a very important distinguishing system of TTP, as a system that is almost never seen in other platelet disorders such as HUS. These neurological symptoms usually present as cognitive impairment in the form of confusion or altered mentation. Alright, those were the 5 main symptoms of TTP that you should know about. However, there is one more symptom that is a little bit less common, but still may show up on the exam. One of the fans is standing right up next to the window. She was definitely injured in the car crash, but she's so excited about seeing Adam here that she doesn't seem to mind that she's bleeding from a cut. This bleeding is our symbol for, well, bleeding. You see, the excess consumption of platelets in microthrombi leads to fewer working platelets in our circulation, which can eventually cause mucocutaneous bleeding. Specific symptoms include epistaxis, petechia and purpura, gingival bleeding, as well as heavy menses in women, formerly known as menorrhagia. Remember those splattered tomatoes? If you focus in on the shape of those tomato chunks, you'll see that they look kind of like fragmented red blood cells, formerly called schistocytes. Schistocytes are the fragments of red blood cells created when they try to squeeze past microthrombi in small blood vessels and are sheared by mechanical stress. In patients with TTP, these schistocytes can actually be visualized on a peripheral blood smear. Pathologists sometimes refer to schistocytes as helmet cells, since the shape of these cells can look similar to that of a helmet. Going back to the bleeding fan, you can tell she can't wait for the show to start because she's constantly looking down at her watch. Some blood even dripped down onto that watch. The blood on the watch is our symbol for increased bleeding time. Since she's bleeding on the watch, that keeps time. Bleeding time is a laboratory measure of platelet function, in particular, the time needed to form a platelet plug. But as we mentioned earlier, patients with TTP have a decreased functional platelet count due to the excess consumption of platelets and microthrombi all over the body. Increased bleeding time is really just another way of telling you something is wrong with the platelets in the body. Finally, let's review the treatment options for patients with TTP. Adam didn't want to go check on his fans empty-handed, so he brought over some cool stage toys for them to use during the show. These aren't just any props though, they're the light-up plasma balls you always see at concerts. These plasma balls are our symbol for plasma exchange or plasmapheresis. Remember how earlier we mentioned that the ADAM-TS13 enzyme is inhibited by an autoantibody in the blood? Well, this antibody is usually found in the plasma of the blood. The point of plasma exchange is to remove the patient's plasma with the unwanted antibody and replace it with new plasma that does not contain the antibody. As a result, plasma exchange effectively stops the inhibition of ADAM-TS13, which is the root cause of TTP. This plasma exchange treatment can be life-saving, although repeated plasma exchange may be needed over the lifetime of the patient. Alright, that's it for this video on TTP. Let's recap. TTP, short for Thrombotic Thrombocytopenic Purpura, is a platelet disorder caused by autoantibodies targeting an important enzyme called ADAM-TS13. ADAM-TS13 normally functions to break down VWF, so when ADAM-TS13 is inhibited, a buildup of VWF results. This buildup of VWF in turn causes platelet plugs to form all over the body, which can get stuck into small vessels as microthrombi. Epidemiologically, this disease primarily affects young women. Clinically, excessive consumption of platelets into microthrombi causes a decrease in functioning platelets or thrombocytopenia. What's more, microthrombi in small vessels can destroy red blood cells as they squeeze past, causing microangiopathic hemolytic anemia, or MAHA. These sheared red blood cells can be visualized as schistocytes on peripheral blood smears. What's more, these microthrombi can block blood flow to small vessels and organs, leading to acute kidney injury and neurological dysfunction. Fever and systemic inflammation are often seen in patients. Lastly, the decrease in functioning platelets leads to signs of mucocutaneous bleeding. Apart from reduced red blood cell and platelet counts on laboratory testing, increased bleeding times are also seen. TTP can be treated through repeated plasma exchange. And now we're actually done with thrombotic thrombocytopenic purpura. See you next time.